Hi, my name is Anton Caballero, and I'm the founder and the CEO of Heuristik Technologies. And today, I'm going to show you the next billion-dollar idea. Last year, they cut the wrong leg to a woman, but this is not just the only misidentification error. In Europe, actually, last year, 145,000 patients got a misidentification error, with a market cost of 64 billion euros. In the US, misidentification errors are the third main death cause, just behind strokes and diabetes, and killing 250,000 patients each year, with a market cost of $400 billion. These misidentification errors are mainly caused because of identification bracelets, which actually cause the 54% of those identification errors. Mainly because they wear off with the use, some of the patients refuse to use them, and also like doctors or nurses provide the wrong bracelet to the patient. A normal hospital spends around 1,000 euros per day on bracelets, with a cost per unit of almost €1. These statistics show that the identification bracelets are not accurate enough, they are super expensive, so a normal hospital will spend around 30,000 euros per month on bracelets, and that they are not environmentally friendly at all. So they only have one use actually, and then they have to throw them away. That's why we have created the fastest, safest, and most accurate way to identify patients, biometrics. We actually scan the patient's fingerprint and we link to the medical record. We are compliant with GDPR because we don't have access to the patient's information. We just focus in the biometrical part. In order to make the implementation on a hospital, we can implement it directly in their working program, or we can create them an identification program. In the hardware side, we just plug and play our static device with a USB connection, or we can provide our tablet, so nurses and doctors can move around the hospital. Talking with our customers, we discovered three main areas: reception, to identify the patients when they come into the hospital, or operation and recovering rooms, in order to identify the patients before, during, and after the operation. We are also working with ambulance companies. Here you can see our pilot with DIA, which is one of the largest ambulance companies in Spain, and you can see how the ambulance staff identify the patients with the fingerprint. We also have a customer-based business model, so actually the health entity will pay a monthly fee for the identification and a renting model for the devices. So in case one device gets damaged, we can replace it in a matter of days. We also have a super experienced team, which all the areas covered: business, marketing, artificial intelligence, and software development. We also have key mentors to help us in the main areas, like fundraising, like penetrating the health market, and for sure, helping us pilot our solution in hospitals. We have 2 signed pilots for the next year with DIA, one of the largest ambulance companies in Spain, and Osakidetza, which is the public Basque health system. We also have some prospective pilots for the next year. We have almost 12 pilots around Europe in 3 different countries. These are the main ones. We also have participated in some of the most relevant acceleration programs in Europe. These ones are the healthcare acceleration programs and also the non-healthcare acceleration programs. We also have international partners in order to help us penetrate the market, and we want to give the investors the chance of investing on us €500,000. With that money, we want to make as much pilots as possible the next year. We are also looking for health entities in order to apply to European grants the next year, and we see ourselves as the leading healthcare biometric company in Europe in the next 3 years, and also starting our piloting our solution in the United States. Thanks a lot, and if you have additional questions, just contact me. Thank you.